What's up, YouTube? Today we are discussing the Wuhan coronavirus, more commonly known as COVID-19. With all the infections currently happening in the world, a lot of people are asking a lot of questions. Information, however, like anything on the internet, can be turned on its head, and sometimes there are a lot of fake reports or false information that leaks out. Here are some questions that can be answered and some facts about the COVID-19 disease. COVID-19 is the infectious disease caused by the most recently discovered coronavirus. Coronaviruses, or coronaviridae, are a large family of viruses which may cause illness in both animals or humans. In humans, several coronaviruses are known to cause respiratory infections, ranging from the common cold to more severe diseases such as Middle Eastern Respiratory Syndrome, or MERS, and Severe Acute Respiratory Syndrome, or SARS. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019, hence the name COVID-19. The most common symptoms of COVID-19 are fever, tiredness, and a dry cough. Some patients may have aches and pains, nasal congestion, runny nose, or a sore throat. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. These patients are called asymptomatic. Most people, about 80%, recover from the disease without needing special treatment. Around 1 out of every 6 people who do get coronavirus become seriously ill and develop difficulty breathing. Older people, and those with underlying medical problems like TB, high blood pressure, heart problems, or diabetes, are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention immediately. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when an infected person coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects and surfaces, then touching their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from an infected person who coughs out or exhales droplets. This is why it is important to stay more than 1 meter or 3 feet away from a person who is sick. Studies to date suggest that COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. This is also one of the main reasons why personal hygiene, for example washing your hands regularly, is so important. The risk depends on who you are, and more specifically, whether there is a COVID-19 outbreak unfolding there. For most people in most locations, the risk of catching COVID-19 is still low. However, there are now places around the world, cities or areas, where the virus is spreading. For people living in or visiting these areas, the risk of catching COVID-19 is higher. Governments and health authorities are taking vigorous actions every time a new case of COVID-19 is identified. Be sure to comply with any local restrictions on travel, movement, or large gatherings. Cooperating with disease control efforts will reduce your risk of catching or spreading COVID-19. Another factor to consider is your general health. If you are a healthy person with no underlying infections or pre-existing medical conditions, and you are serious about personal hygiene, then your risk of infection is lower. However, this can change in the future. People with underlying medical conditions, compromised immune systems, or generally unhealthy people are at a much greater risk. COVID-19 outbreaks can be contained and transmission stopped, as has been shown in China and some other countries. Unfortunately, new outbreaks can emerge rapidly. It's important to be aware of the situation, where you are or where you intend to go. The short answer is no. The virus that causes COVID-19 and the one that causes Severe Acute Respiratory Syndrome, or SARS, are related to each other genetically, but they are different. SARS is more deadly but much less infectious than COVID-19. There have been no outbreaks of SARS anywhere in the world since 2003. An incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period for COVID-19 range from 1 to 14 days, most commonly around 5 days. These estimates will be updated as more data becomes available from the World Health Organization. If you like this video, hit the like and subscribe button. Don't forget to click on the notification bell icon so you can always be up to date on new content being released. As mentioned earlier in this video, misinformation tends to lead to a lot of unwanted mistakes. Here are a few fact or fiction pieces that may shed some light on the COVID-19 disease. I hope this video was informative and that it could give some people the answers to the questions that they have. The links to the source information are in the description below. Once again, please don't forget to hit that like and subscribe button and turn on the notification bell icon to be updated on future releases. Until next time.